Think about the last time you went out. Did you stop counting after 1, 2, or did you stop counting after a few? According to the CDC, in West Virginia, 1 in 5 adults report binge drinking. Alcohol Awareness Month is about moments like this, just stopping to check in.
55% of West Virginians live in rural communities just like this one, making it one of the most rural states in the country. And when you live miles from a hospital or a clinic, getting care isn't always that simple. From buses to volunteer drivers, the goal is to close the transportation gap between where people live to where they need to be. With 1 in 3 women experiencing violence in their lifetime, walking down an alley like this one can be terrifying. But police say with simple tools like this one, which is just under $20, can help women feel safer and more prepared. I'm Alondra Molina. Not everyone has access to the hospitals like the one you see behind me. Now millions of dollars are being invested to transform rural health care, but the clock is ticking to make it work. I'll have that story coming up on WVU News. But for a lot of young West Virginians, the biggest health challenge isn't something you can see. Mental health, anxiety, and depression. According to the report, more than 22% of people in the state say that they experience poor mental health days for 14 or more days per month. This is one of the highest rates in America. Grammy Award-winning musician Tim O'Brien took the stage at WVU's Kennedy Creative Arts Center for an evening with Tim O'Brien. O'Brien, a Wheeling native, has spent nearly 5 decades on the national bluegrass scene, earning multiple Grammy Awards and 3 IBMA Male Vocalist of the Year honors.
Hearing bluegrass that way in a small room was always transcendent, and it was the amazing technique, the sound coming off those instruments and the technique that they played with was inspiring.
O'Brien spent the day working with WVU's bluegrass and old-time bands, preparing them to perform alongside him later that night.
I love the cycle of it. I love to hear what the new kids are into and what they have ideas about things that wouldn't occur to somebody like me. And some of them I like and some of them I don't like, but I think the truth is the music won't survive if it doesn't evolve.
Dr. Chris Haddix, director of WVU Bluegrass and Old Time Bands, says this experience gives students a rare look at what a professional music career is really like.
So to talk with somebody who's been there and can relate the experiences and offer little pearls of wisdom and like, hey, I did it. You know, you can do it.
Over 20 million people listen to bluegrass in the U.S. Now, WVU Bluegrass and Old Time Bands are joining the Appalachian tradition with Grammy Award-winning Tim O'Brien, showcasing what music really means to the Mountain State. For O'Brien, moments like this are what keeps music alive.
I'm always learning new things from people that I collaborate with, and I'm learning a different approach, a different view, a different angle on the music, and that's great because I don't want the music to get stale for me ever. I want it always to be something fresh that I love.
A night of music and mentorship left a lasting impression on the students who shared the stage with a legend. It's loud, it's sweaty, but that's exactly where Farah Ahmed wants to be. Farah would describe herself now as a healthy version of what she used to be only 2 years and 9 months ago.
I could barely eat. I was like not working out at all. I was mentally so sad and so I just felt so alone until I could go out and drink and party with my friends and get a drink in me.
A far cry from where Farah was only 995 days ago.
I feel so much closer to myself than I ever have. I trust myself. I always know what I'm saying or doing, and I still go out and I have so much more fun because I'm present.
And it was only 2 years and 9 months ago where Farah says her routine looked very different.
I just totally felt like I lost my sense of self or my identity. It was all around drinking all the time.
Farah isn't alone. Health officials say one of the biggest problems with alcoholism is not drinking alcohol every day. It's binge drinking. That means drinking 4 or more drinks a day if you're a woman.
Think about the last time you went out. Did you stop counting after 1, 2, or did you stop counting after a few? According to the CDC, in West Virginia, 1 in 5 adults report binge drinking. Alcohol Awareness Month is about moments like this, just stopping to check in.
More than 20% of Americans admit to binge drinking because it's a part of their societal norm. But addiction therapist Laura Lander says that's a mistake.
Is also almost more dangerous because of the acceptance of alcohol use, because of the legality of alcohol use, and that it's really accepted in our culture, not only to use alcohol, but to become intoxicated.
For Farah, drinking because it was a social norm in college is what led her down the path of alcoholism.
Learning to live inside of your head can be so uncomfortable, but learning to numb without a substance like alcohol is also so rewarding because you can feel it fully.
Now, 2 years and 9 months later, Farah says she stays sober by being more active and taking care of her mental health.
It's such a privilege to be full of joy, full of sadness. It's the balance of both the good and the bad that makes the good so much better, which I think is something I didn't even know life could get this good.
Hey now, hey now.
Farah says she now lives a simple life, playing her guitar and running the Morgantown Walk Club.
The majority of those elected to the Senate have voted in the affirmative.
The federal award is one of the largest per person in the region, and state leaders say it's meant to modernize how healthcare works in rural West Virginia. But one of the biggest barriers isn't the doctor, it's the drive.
West Virginia in general is really lacking in ways to transport and also just health-wise. We have a lot of health problems, both mentally and physically. So having more health in general for people who really need it would be an amazing addition to West Virginia.
55% of West Virginians live in rural communities just like this one, making it one of the most rural states in the country. And when you live miles from a hospital or a clinic, getting care isn't always that simple. From buses to volunteer drivers, the goal is to close the transportation gap between where people live to where they need to be. A new rural health transformation program aims to change that. Dr. Clay Marsh, Chancellor and Executive Dean for WVU Health Sciences, says the investment is significant.
As we look at bringing new technology, new capability to rural health practices, we hope that's going to, to make a difference in the longer term practice of medicine in rural parts of West Virginia.
Hospitals and local health centers will be able to upgrade equipment, add staff, and share patient information more easily. Officials hope more people will get treated and follow up on care without the burden of time and travel.
Our real focus and the real benefit that we would be able to bring West Virginia sustainably is to improve the health of the population.
While the program will continue over the next few years, Marsh says the impact could last much longer, helping rural communities build a stronger system of care. Alondra Molina, WVU News, Morgantown.
And I'm glad you brought up the socially acceptable part because it's so normalized here at WVU. So could you give us maybe some tips and tricks on how people can check up on their friends and maybe if their friend does have a problem, where they can go to seek help?
Sure. One of the ways you can detect a problem is when someone seems to not really be able to control their use anymore. They're drinking more than they want to or more frequently than they want to. And it's also having negative consequences in their life, either socially or academically or at work.
O'Brien has been a fixture in folk and bluegrass music for 50 years. He also plays several instruments, including the guitar, mandolin, fiddle, and banjo. I met one young woman who faced alcohol addiction and is now finding peace in her life and hopes to inspire others with her story. Health experts point to national research showing that just 30 minutes of moderate exercise 5 days a week can lower your risk of heart disease by up to 30%. Recovery from addiction is possible. If you or someone you know needs help, please call the number at the bottom of your screen or visit findtreatment.gov.